Hello everybody, this is Sharon Parlia, your instructor for Fundamentals of Health Informatics, T2060. And today we're going to discuss Module 4, and the topic is telemedicine. I hope you enjoy it, so let's get started. I'm going to start with an overview of what we'll be discussing in this module. First off, we're going to talk about telemedicine and what it actually means. Then I'd like to discuss what services can be provided by telemedicine. Next, what methods can be used for telemedicine. And lastly, we'll go into a discussion about what are the benefits of telemedicine. It's a new field and it's an exciting field as well. So what is telemedicine? Well, by definition, telemedicine is the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health status. This is, as opposed to a patient coming into a doctor's office, this is, telemedicine is a doctor seeing a patient not actually in the office. Telemedicine includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and many other forms of telecommunication technology. Now let's talk about some of the services provided by telemedicine. One service is primary care and specialist referral services. This includes the primary care or health care professional providing a consultation with a patient. So it's actually from a patient to a doctor using telemedicine as a communication tool. The patient can show a doctor something, maybe a rash, or have a discussion about symptoms they may be having. Another way is a specialist assisting the primary care physician in rendering a diagnosis. So that in this method, it's more like a physician to a physician, providing services to each other via telemedicine. Can also be remote patient monitoring. This includes telehealth. You can supplement the use of visiting nurses by having telemedicine available. You can use devices to remotely collect and send data for interpretation, such as vital signs. You can monitor blood glucose monitors or ECGs, and this information can go right through the phone lines now. Other services provided by telemedicine include consumer medical and health information. This includes the use of the internet and wireless devices to obtain specialized health information. It actually promotes online discussion groups and peer-to-peer support groups. It's an excellent tool. Another service is medical education. It provides special medical education seminars for groups in remote locations. It also provides medical education credits for healthcare providers. Often in remote areas, people can't get to seminars and learn about new and cutting technology as far as it relates to the medical field. Now there's a way to broadcast this out and have discussion groups as well. So what are some of the methods used for telemedicine? How does this all occur in the background? Well, first of all, there's network programs. There's dedicated high-speed lines or internet use, telecommunication links between such sites as hospitals and clinics that connect to rural sites, and clinics and community health care centers. This is all done behind the scenes where there are dedicated networks just for the use of telemedicine. There are approximately 200 telemedicine networks providing connectivity to over 3,000 sites today. There's also point-to-point connections. Hospitals and clinics provide direct services to specialty services and independent providers. This is often used for radiology, stroke assessment, and mental health services, where the patient, it's a direct connection between the hospital or the clinic and the patient. Continuing on with the methods used for telemedicine are monitoring links, This is the use of landline or wireless connections to communicate directly between the patient in their home and the hospital and/or clinic. This is often used for cardiac, pulmonary, fetal monitoring, and other home care services where you can actually hook right into the phone line. Another method is web-based or e-health patient service sites. These provide direct services over the internet. They include sites to provide direct patient care. Let's talk about some of the benefits of telemedicine. One benefit is improved access. Just think of the amount of people in the beginning stages of the internet that were able to be reached. Telemedicine is very cutting edge. It's used to bring healthcare services to patients in distant locations that otherwise would not have access to some of these services. It also allows physicians and healthcare facilities to expand beyond the reach of their own offices. Now they can connect to patients anywhere at any time. And it has the ability to increase services to millions of new patients. Like I said, it's cutting technology. It's being recognized by regulatory agencies. They're looking into it for billing purposes as well. It's all new still, but it's going to be the way of the world. Another benefit of telemedicine are the cost efficiencies. Reducing costs of healthcare is one of the most important reasons for adopting telemedicine technologies. We're trying to reduce the cost of healthcare every day, and this is, an excellent way to do it. Through better management of chronic diseases, shared health professional staffing, reduced travel times, and fewer shorter hospital stays, healthcare costs can be reduced. Think about it. Less travel for the patient. What a convenience. Being able to share staff from a medical perspective. That doctors can share their some of their staff and cut their own costs. Big cost savings, when it comes to telemedicine. Continuing with the benefits of telemedicine is the improved quality of care. Many studies have been shown in the quality of healthcare services using telemedicine are as good as those given in in-person settings. So just because you're in an office or whether you're face-to-face, on a computer screen, you could be getting the same services from a physician. And in some areas, telemedicine has been shown to deliver superior results, especially in the mental health and ICU care. Mental health patients that can talk to a doctor from their own familiar surroundings in their home, and they don't have to leave, and they can talk to a doctor in his office or, his facility, makes the patient more comfortable and more likely to meet with the physicians on a regular basis. And lastly, another benefit of telemedicine is the patients are demanding it. The consumers want telemedicine. This alone is a reason to, keep pursuing this field. The greatest impact of telemedicine is on the patients, their families, and their community. Think about it. Telemedicine reduces travel time and the stresses related to traveling to a physician's office. Not everyone has a car. They have to take public transportation or buses or rely on family members or neighbors. This is a big stress reduction. Studies have also indicated that patient satisfaction is very high when it comes to telemedicine. Now I want to talk about some other examples of telemedicine. We've been focusing on, the patient in their home or in a remote location and a doctor in their office, but there's other uses for telemedicine. One of those is telesurgery. This allows remote surgery allows a doctor to perform surgery on a patient even though they are not physically in the same location. This is also very cutting edge, but think about it. Not everyone can get to a top name hospital, in a big city. Some people rely on their community hospitals, but yet they want, that cutting edge technology, and this is now, now the ability is there to be done. Another part of telesurgery contains some elements of robotics and communication technology. Some of you are in healthcare. You might have heard of the Da Vinci device, where the doctor's actually using a robot in the operating room. Lastly, I just want to mention that in the future, this will allow the expertise of specialized surgeons to be available to patients worldwide. As I said, this, opens up a new door when it comes to, surgeons and, where we're going in the future. Lastly, I want to just touch on some other examples of telemedicine, including telecardiology. This is where ECGs, electrocardiographs, are often transmitted using telephone and wireless devices. This is taking place today as well. Telepsychiatry, I think I've mentioned this previously. This utilizes video conferencing for patients to access psychiatric services. Again, some patients feel more comfortable in their own surroundings. And telepathology, this is where we use telecommunication technology for the transfer of images, image-rich pathology data for the purpose of diagnosis, education, and research. This concludes Module 4. I hope you all learned a little bit more about telemedicine, and I hope you enjoyed it, and I will see you on the next module. Thank you.